Hey everybody, this is Dr. Phil here at Impact Health, and we're going to be talking about Get Over Your Hump Wednesday. This is Rachel. She's a USF PT student. She's going to help me do a little bit of breathing for you. So do me a favor, slide a little bit to your right. Okay. We're going to talk a little bit about breathing and how it relates to posture and back pain. This is one thing I think we tend to miss a lot on when we talk about breathing and posture. So I'm going to show you some do's and some don'ts. It's going to be two parts. This part's going to be, part one is going to be the inhale, part two is going to be the exhale, because I want to give you guys a little bit too much information, so this way you can practice it the right way, so that this way when you go to work on it, you're actually getting the right results and you can feel the difference between the two. So one of the things I'm going to talk to you about first is the incorrect way to breathe. So a lot of people, when they take deep breaths, they think of taking a deep breath with your chest. So do me a favor, take a deep breath with your chest. See, and then relax. And so this is a lot of times where people will try to do thinking and they're taking in a deep breath. Well, when you breathe that way, you use your secondary muscles, different muscles in your neck, your chest muscles, different muscles by your clavicle. Your primary breathing muscle is your diaphragm, which is down in this area. And so in order for you to really take a deep breath, you want your abdominals to come out. And it kind of sounds like an oxymoron, but taking a deep breath from here actually is more of a shallow breath and should be done when you're exhausted. And so to get oxygen in quickly, you use your secondary muscles because they move you faster. So the right way to breathe is going to be sticking your gut out and having it come out, so this way the diaphragm comes down and actually pulls your lungs down to give you more space to be able to take a deeper breath. The easiest way to do it is in lying down, so I'm going to show you guys how to do that, because this is going to be a little bit more difficult in a sitting position until you get it right. So I'm going to have her lie down. Go ahead and lie down for me, Rachel. And so it's a very simple way to practice. You're basically giving yourself your own feedback. And so you're going to have one hand on your stomach, one hand on your chest. So that this way, when you take a breath, again, if you do it incorrectly, do the incorrect, Rachel, you'll see your chest rise up and you almost arch your back. And so one of the reasons why that's very bad to breathe that way as opposed to your diaphragmatic breath, the breathing in the lower abdominals, is that when you use your upper abdominals to breathe in your chest and the secondary muscles, is it causes the spinal muscles in your lower back to tighten up a lot more. And so people have a lot more back pain, or more result to that, because it puts you in a more extended position in your lower back and actually turns those muscles on. So when you breathe the right way, you can actually have the opposite effect. So that's going to cause your muscles to tone down a little bit. So again, very quick and dirty. The reason why you have both of your hands is that so you feel the pressure here, you don't feel the pressure here. And if you feel anything coming up here, you're doing it incorrectly. And so you want to give just a little feedback pressure in the tummy, so that as you inhale, you feel your hand rise in your tummy all the way out without your chest moving. And that's how you know you're doing it right. If you're coming up with your stomach and the chest is moving at the same time, you're not getting that real deep breath. So don't be afraid to give yourself a little pressure in your stomach. So as you inhale, this is not moving at all, just like she's doing now, and everything is coming into here. You should do it slowly, because it can be very tiring when you do it right. So this is part one of it. I'm going to do part two as well, but this way you guys can practice this. And so the thought is, you smell a rose, you blow a candle. So you're going to take a deep breath with your nose, and you're going to basically stick your tummy right out. That's going to be part one. So practice that, and then when you watch the second part, you'll be able to understand the exhale portion too, because there is a correct method for doing that as well too. So if you feel this coming up, wrong. If you feel your tummy coming up, right. Okay? Practice that and look at part two so you guys can see the second part of it.